Okay, it's 11 o'clock, so we'll get started. Good morning and welcome to the McGill Dementia Education Program's Caring Conversations. This is another free community outreach initiative to provide virtual support to care partners of people living with dementia. I'm Joanne Besner, and I'm here with my partner, Lucy Barylak. This fall, we are hosting conversations about caregiving and the various issues that affect the lives of care partners. Caring Conversations is a project of the McGill Dementia Education Program and is supported by the Petro-Canada Caremakers Foundation. Before we tell you a little bit about ourselves, we just want to request for sound quality that you keep your microphones turned off. So click that mute button, and we will unmute people as we start our discussion. So Lucy, why don't you start by introducing yourself?
Thank you. Good morning, everybody. My name is Lucy, and at times I'm called Dear Lucy when I do podcasts in the US. I worked in the healthcare system as a social worker manager for over 35 years. I developed and managed the Caregiver Support Center at the CLSC Rene Cassin. I then joined the research department, developing assessment tools to identify specific service needs and difficulties that caregivers go through. And I want to tell all of you that I was a caregiver for my mother for over 10 years. Joanne.
So hi, I'm Joanne Besner, and I'm otherwise known as Coach Jo. I also worked in community public health in the CIUS Centre West, in CLSCs, for over 35 years, in home care, in nursing home placement, and a caregiver support center. I retired 3.5 years ago. But more importantly, like Lucy, I'm also a caregiver to my elderly parents. And for those of you who feel sandwiched, I'm also a grandmother to 2 little ones. So I often do feel torn between those 2 roles. So today we're going to be talking about some of the behaviors associated with dementia that can really challenge us as caregivers. We invite you always, please join in our discussions. We're going to share some information, but you are welcome anytime that you have a question or want to add your own thoughts and experiences. We'd like to ask you to do that by raising your hand. So if you're on computer, just use the hand icon in the reaction tab at the bottom of your computer screen. For those who have phoned in, you can raise your hand by dialing *9. And just a reminder, you can always ask your questions in the chat box and someone will read them out loud and we'll be happy to answer. Also, a reminder that this webinar or this discussion is going to be recorded, but it will not show any of your faces, just us, Lucy and myself, and we will hear your voices if you ask questions. So I think at this point we can begin, and I'm going to do that. We have a few slides that we're going to share with you. So I just have to pull those up and we're going to get started. Okay, so here we are. Okay, so our topic today, behavioral challenges. So what we're going to talk about is what exactly is a behavioral disturbance. Why is this topic so important? We're going to look to what's behind dementia for the reasons of why these behaviors exist. And we're going to cover examples that are verbal, physical, and sexual in nature. And as we always promise, we're going to give you tips to manage these behaviors and end with you joining in on our caring conversation. So to start, we just want to clarify, so what are the challenging behaviors that we're talking about? They're generally known as behavioral and psychological symptoms of dementia, and they come on as the disease progresses. So these are distressing actions or patterns due to an inability to do something. They're actually a form of communication. Your loved one may not have, again, the use of language, so they're attempting to communicate a personal need through their behaviors. And why is this so important? Well, as we just said, Our loved ones are trying to communicate something to us by their behaviors. And this is a mystery for us. It's our job as caregivers to try to figure out what are they trying to tell us so that we can help them. And this is what we're going to focusing on today, helping you do that. And the importance also for us, often this could be the most distressing part of the illness for caregivers to watch. It can make us feel helpless, sometimes hopeless, and it contributes to fatigue and a sense of caregiver burden. And finally, we do want to emphasize that there are options and alternatives that we can try before we move to medication. Medication is definitely an option, but we wanted to first try some less invasive alternatives. So we'll be sharing about that today. And now I'm going to turn it back to you, Lucy, to talk about what are the causes.
Thank you for that. So let's remind ourselves, what is dementia? Dementia is an overall term for a set of symptoms that is caused by disorders affecting the brain. Symptoms may include memory loss and difficulties with thinking, problem solving, or language severe enough to reduce a person's ability to perform everyday activities. These dementia symptoms are irreversible, which means that any loss of their abilities cannot come back. Caring for someone with some of these difficult behavior is not easy. It can be very frustrating, overwhelming. You can actually lose your temper. You can get angry and then feel very guilty. But what I think is really important is to be able to acknowledge our feelings. You're only human, and remind yourself that this behavior is because of the dementia. When you feel like your blood pressure is rising up, going up full speed, take 10 big breaths. It really works. I know. I use that technique many, many times. Next, please. Okay, so let's look at signs of dementia. So it's difficulty understanding, difficulty retaining certain events and information, memory loss and repeating questions, impaired judgment, disorientation to person, place, season, and time. All these things are extremely difficult to handle and to work with. Next, please. So what causes the dementia? Dementia affects parts of the brain that controls a person's ability to control their own responses. The most important thing to understand, it's not something they're doing on purpose. As well, their sensory perception may have been affected. Their sight, their hearing, their eyesight, their smell, their touch. Sometimes when a person with dementia passes a mirror, they see themselves in the mirror, but they don't recognize themselves. And they could think that it's a stranger. They can get very, very upset. They can scream, they get angry. They can see a shadow and think that a stranger is in the house, and their mood can change. A rug on the floor may look like a hole, and they don't want to pass it. So these are their mood changes, and for whatever reason, you really have to understand, where is this coming from? Next, please.
So, Lucy, you started to talk about what these behaviors may look like. So we put together just a brief list. And I'm going to read through them. And if you're going through experiencing some of this, please, we invite you again to put in the chat something that we haven't mentioned here. So we start with repetitiveness. This is a very common one and can be extremely irritating. Your loved one can be repeating sentences or phrases, or they might be repeating behaviors, doing the same thing over and over again. Wandering. They could wander away from you if you're just walking in a shopping mall, or they could wander away from your home. And this is obviously concerning, because then we start to worry about safety. Agitation and aggressive, also a very common one. Sundowning. Lucy, you talked about mood changes. Sundowning are mood changes that happen at the end of the day when the sun starts to go down. And of course, there's the difficulty of paranoia, delusions, and hallucinations, thinking somebody is out to get you. Screaming. This is one is heart-wrenching, is listening to somebody screaming and feeling so helpless about it. Sleep disturbances. Sometimes your loved one may just get up, go back to sleep, get up, go back to sleep, or just be thrashing and agitated. And then there's some behaviors that are associated with an activity, like resisting hygiene or being sexually inappropriate as well in a group of people. So again, I invite you, please share, or if you want to raise your hand at any time, join us. Ooh. So I've described some of the behaviors, and if we realize our loved ones trying to communicate something to us, what is the message for us? So they could just be simply feeling tired. They could be in pain. They could be uncomfortable. Perhaps they've been sitting too long, or perhaps they've been in bed too long. Their clothing could be bothering them. There could be a tag that's itching them. They're unable to tell us. They could be hungry or thirsty. They could need to use the bathroom or have already soiled themselves and need help. They may be too hot, too cold, and also have emotions and be unable to express. They're afraid or lonely or maybe bored. Boredom is a big one, or excited. And of course, they could be angry or upset about something happening. So this really, I forgot to make my screen big here. Sorry about that. This could be about being angry and upset as well. So how do we figure all this out? How do we figure out what they're trying to tell us? So 2 big words, observe and journal. So just step back. The best way is to look at what's happening and grab yourself a pen and paper or a journal. What event is going on? When is this happening? And what time of the day is it? Did something trigger them? Is there an activity that you're about to do or something coming up? Like, is it mealtime? Are we headed out to a program? Is there a caregiver coming over? And another thing that you could look at is, what's their history? Did something happen that might remind them of a past event? Did they suffer any trauma in their lifetime? So these could be clues to help you figure out what exactly they're trying to tell us. So we're going to start off by just sharing some very brief strategies, some basics. So number 1, if you're at the beginning, you start to see these behaviors coming out of nowhere. The first thing you want to do is rule out illness. So sometimes these behaviors you're not in that stage yet, but there could be something physically wrong. Simple infection, like a urinary tract infection, a pneumonia or a flu, can cause behaviors. Vitamin deficiencies, high blood pressure. So the first step is going to the physician or your gerontologist and ruling out if there is an illness. So once you've done that, you go back to looking at, okay, what are they trying to communicate to me? What do they need? What can I do to help? So one thing helps to be a little bit proactive are behavior management techniques like keeping a routine. So that means, to the best of your ability, try to do the same thing at the same time every day. So try having them wake at the same time, your meal times, breakfast, lunch, dinner at approximately the same times. If you go out for a walk or you do the bathing, try to keep it to a routine or outings. This way, they will develop a sense of what comes next. So that can help them feel like they have some control. Another tip is about the environment. Diminish distractions. You want to keep it very calm. So is there harsh lighting? Are there a lot of noises in the background? Is the TV on? Is the radio on? Is the vacuum cleaner going on? So looking at that, are there a lot of people in the room? Because we have to recall also that with dementia, our sensory perception is greatly affected. So calmness could go a long way. And finally, recognizing triggers. Try and just step back and see what do I think just happened? What just caused this behavior? So speaking of triggers, we want to talk about it's so important how we communicate with our loved one, especially during these times, because energy is so contagious. But although we're looking for the triggers in our loved one, it's so easy for us to get triggered. These are such tough behaviors. And as you said, Lucy, we're just human beings. So we can get set off. I mean, we may be tired or impatient. So the first thing we ask is that we be patient. Of course, patient with ourselves and also patient with our person. Talk to them one-on-one, really face a person, never come from beside a person and take them by surprise. And be brief, use very simple words. Be aware of your nonverbal as well. Smile, hold their hand, take your time and connect. If you can, use their words, mirror what they're saying, because that has meaning for them. You can stop and ask them a question. And whatever you're doing or trying, if it's not working, just stop, take a minute, step back. I love that technique, Lucy, that you talk about, those taking the 10 breaths. That's a great strategy. And just wait a bit and try again later. And I guess most important is really to pick your battles, decide what's important for you, because you need to focus on your quality of life too. And we're not going to win on everything. So, Lucy, I'm going to pass it to you on this sensitive topic.
Well, thank you so much, Joanne. That's a lot of information for people just to sort of observe. And if anybody has any comments or if you would like to ask a question, by all means, do so. Okay, we're going to talk about sexuality. This can be a tough topic to talk about, but it's really, really important. Some people with dementia really lose their inhibitions and exhibit sexual advances. It could or could not be related to sex at all. The behavior is their way of showing an unmet need. So let's look at this a little bit closer. So inappropriate sexual behavior could be towards yourself. It could be to another family member. It could be to a stranger. It can be to a private help that you may have hired in the house. Disturbing, it's really disturbing, it's frightening, and it's embarrassing situation for caregivers to find themselves in, especially if it's something new that is recently happening. You know, sexuality touches our value system, our culture, our beliefs, our religion, how we have been raised. How we ourselves feel about sex, especially as we age, will determine how you are going to actually address this behavior. You know, the need for close human contact does not decline with age or dementia. Sexuality and intimacy are a fundamental part of human existence. Keep in mind that many seniors continue having very meaningful sexual relationships throughout their lives. Even if the sexuality declines or the performance declines, we all need human touch. That can be, experienced in many different ways. If you have discomfort talking about sex or intimacy, it's going to be difficult for you to deal with that. And what I would recommend is maybe you need to talk to someone about why you're feeling so apprehensive, what makes you so uncomfortable about talking about sex or intimacy, or what's going on with the person you're caring for. So as we said before, those with dementia communicate with behavior rather than speech. I see that there's something in the chat, and if somebody could read that out for me.
Yeah, I'll read that. So this is a question. I don't understand. Does my partner know he is on hookup dating sites? We had a great sex life. Oops, sorry, it just jumped. Scroll down. I'm heartbroken. Now he's normal with medication, but how can I stop this behavior? I worried I don't know where the money is, and I'm angry being betrayed.
Okay, let me understand so that it's a little bit clear. So your partner is going on chats, or is that what he's doing or she's doing?
It says hookup dating sites.
Hookup dating sites. Okay. So my question first and foremost would be, does this person have dementia? or are we just talking about just a regular relationship that this person is hooking up with different chats? I think there should be a little bit more of an explanation in that. Is it possible for you to answer my question, please?
You can answer in the chat if you'd prefer to answer in the chat. Yeah, so he is possibly having prefrontal temporal lobe dementia.
Okay. Well, first of all, I want to say that, it must be very upsetting for you. There's no doubt about that. It's, it's a form of betrayal. And it's really important for you to understand that something is going on, that he's not functioning the way he was before. I think that I would also ask you, when was the last time that your partner was seen by a doctor? I think it's important to kind of assess, as Joanne had said, maybe something else is going on there as well. And this behavior is aggravated by other situations.
Okay, so he's in the middle of a diagnosis at the moment.
Okay. So I think it's important to go through the whole assessment, the whole diagnosis, to really have a much better understanding. But in the meantime, you're allowed to feel as you do. I can understand the betrayal, but at the same time, keep in mind that he's not functioning at the same level that he was before. Just the fact that he's being assessed leads me to believe that something is going on in his brain right now. And it's not an easy process to go through, but be patient. Try as much as you can to kind of think of where it's coming from, his behavior, rather than the behavior itself. And hopefully at the end of that, you'll have a better understanding. And we're going to talk a little bit about other options a little bit later on in the session. But thank you so much for your question.
And we do have another question.
Sure.
One of the biggest challenges I have seen in my parents' situation is that my mother, the caregiver, is so burnt out that her own mental health has declined to a point where she cannot regulate her own behavior, which results in aggression in my father. He is now in a GAB unit in Peterborough Hospital and technically being cared for by dementia experts, but she continues to trigger his aggressive behavior. This results in more medication for my father and risk to the staff at the hospital. The classic chicken and egg conundrum. Any suggestions?
Well, she's very, very angry. She certainly needs help. Maybe all the focus is being paid attention to him right now. I think your mother needs a lot of support, definitely, to be able to deal with that. I'm just, I'm wondering if where your father is housed, whether they have the support for your mother. Maybe she can speak to a social worker and deal with some of those issues. Does she have a good understanding of what your father is going through? Are there any other suggestions that you may have, Joanne?
No, I'm wondering the same thing, actually. It sounds like, of course, she's reacting with all the emotions, and we talked about the energy and how contagious it is. So the best thing she has to be open to it is if she can help to be taught how she could actually make a difference in her husband's behavior and be able to see her part in it. So a lot is through education. I think even, all kinds of education, reading about it, getting help, attending webinars like this. We're so quick to react.
Yes. The other interesting part of all of this, we always assume that relationships are always been wonderful. I mean, it would be interesting for her to be able to access what was her relationship with her husband. Was it good? Was it a positive one? Were there issues? A lot of anger comes back from from history, from the way they had conducted their lives together or their relationship. So I really think that your mother definitely needs some support of her own.
So we have a few more comments here.
Sure.
That's a good question about support. She isn't open to talk therapy. My sister and I are attending all types of support opportunities and have our own social workers. My parents had a very snippy relationship when they were well. No going back now.
There. So that thank you so much, because that's something we need to always look at, make sure that, Some people stay married for all the right reasons and all the wrong reasons. And when they find themselves to be a caregiver later on in life, there's a lot of anger that comes out, a lot of resentment of things that they should have or could have done in the past. Thank you. Okay, are there any other questions or thoughts?
No more questions.
Okay, let's continue. So what are inappropriate sexual behaviors? All right. It could be anything from, grabbing, touching, hugging, groping, masturbating or fondling genitals, sexual language and explicit commands, removing their clothes, exposing self in public. Now, these are really difficult things to deal with. They may accuse you of being unfaithful, having affairs. These are things that I hear a lot coming from caregivers. I guess what I want to speak to you about is just kind of putting things in perspective a little bit. So if the person is masturbating at home and are not hurting themselves, it may be their way of soothing themselves. I believe that it's if you feel comfortable enough to let it go and try not to think less of the person. We have to have empathy. And the most important things when it comes to any inappropriate sexual behavior is please don't shame the person. Okay. And it's also important to let family or trusted friends know what's going on and why, so that they are aware and can be supportive to both of you and not think badly of the person you are caring for. This is a lot of issues like that emerge. Now, there's other tips that we can definitely give you, and we will, but you really try to understand where is all this coming from. Was there a question on the chat?
We do have a comment.
Yes.
So though not sexual, my mother and I often had difficulty in our relationship throughout our life. I see it now in our communications, and it's often exacerbated since he's developed dementia.
Okay. And the question?
So it's more of a comment than a question. So
comment. Okay. Yes. I mean, look, relationships are always very difficult. And as I said before, it all depends what your relationship was like before. And I think the hardest things for caregivers who have not had good relationships with the people that they're now supporting and giving care, there's a lot of issues that have to be dealt with. There's a lot of feelings, as I said, of resentment, of anger. It's very, very difficult. And I have to tell you, you should not be doing this alone. You really, really need the support and the help. I always say that caregiving is very rewarding, but it can be so, so challenging as well, because it brings out a lot of issues from the past, a lot of anger that has not been resolved. So again, I mean, there are a lot of services out there to help you cope with some of that. I think one of the most important things for you to do if you're dealing with someone who has dementia is kind of to forgive, because holding on to that, nothing's going to come of it at this time in your life. But I want to thank you for that comment. It is extremely important.
Right, there's no other questions or comments.
Okay, thank you. All right, so should we proceed, Joanne, or?
Sure.
Yeah, okay. So let's go over some of the tips we spoke about. And these tips can be used for any difficult behavior that you may be facing. So there are 3 key points. Let's remember them. They're so important. Deflect, distract, and redirect. Okay? This is something I had to learn personally when I was caring for my mother. It wasn't easy, but it really works. It's so important to keep calm and remain supportive. Please don't argue or try to correct them. It will not work. Be aware of your body language and tone, your voice, your facial expression. Try to figure out what are the triggers, as Joanne said. What happened? Are they scared? Reassure them that you are here with them. Watch for nonverbal clues, from them. If they touch themselves, their private parts, you can ask them, do you need to go to the bathroom? Distract them by asking them a question. For example, what can I do for you? Would you like to come into the kitchen? We'll make a cup of tea, a cup of coffee together, or any other distraction. You could even take them to another room. Now redirect to a new activity. This really, really helps. You can ask them if they would like to go for a walk, or if you want to take for a drive. Reminiscing is an amazing activity. As you know, with dementia, they remember a lot of things from the past. They might not remember what they ate for breakfast. So reminiscing is great, taking out pictures of family, of weddings, grandchildren, nieces, nephews, whatever it is. Doing a scrapbook together. You can watch a TV show as well. Just distract them. It works. Music. Now, I love music because really music kind of puts things back together. There's a feeling, a sense of when you hear music from the past that you enjoy. Believe it or not, music is really the last thing that goes with people with dementia. They really, they can even sing along some of the words. And for those who played an instrument in the past, I'm telling you, they can go and play at the piano. We had people in the center who really didn't even know their own name, but the piano was there. The lady walked over, opened the piano, and started playing beautiful classical music. We were stunned. Singing along is a great activity, or any activity that you know that they would enjoy. If a person becomes aggressive verbally, physically, or sexually, put a plan in place, please. What I mean by that, let certain family or trusted friends know what's going on. Call them if you need some help. If the behavior escalates and it's not manageable, you may need to call 911 to protect yourself and the person. I also want to say that if they get physically, verbally, or sexually aggressive once, one time, they most likely will do it again. I know a lot of times caregivers says, no, it was only one time. Yeah, but that behavior could most likely will happen again. So I know that we've said an awful lot, and I'm just wondering, do other people in the audience have any other tips that you would like to share with other caregivers? Okay, here we go. What's that?
Oh, we have another comment here. Let me read this. The idea of self-care is really critical for caregivers, and it's important that if all other strategies work and the person remains aggressive or dangerous, it's okay to call 911 for help. This is particularly important when the person could also be a danger to themselves or others. Hospital staff can rule out illness and then make connections to social workers and supports if they haven't already. Also, just because a person has a good day, it doesn't mean that there won't be a bad day on the horizon.
Yeah, a lot of really good points in there. Thank you for whoever added that. It's really important to say, we as caregivers, we want to cope, we want to understand, but we want to keep ourselves safe. We want to keep our loved ones safe. So it's very important to know when the line is being crossed and when we do have to call out for help and protect ourselves and our loved one as well. Thank you for that.
Excuse me, I wanted to ask a question. I don't know if you can hear me.
Perfectly. Please go ahead.
Okay. So from the time that I had to deal with this situation, I started reading a great deal about it. And there's a lot of literature out there about what goes on, how to deal with things. Needless to say, dealing with it, being a caregiver, you can be told a lot of things. Unfortunately, you are the person writing the book could have been a part of it, but if not, and you are being, a part of a service, it's very difficult to understand if you are not walking in their shoes. And I just wanted to add that. But one of the things that I did read was that when a person is a certain type of personality, when they are young, when they are children, when they're growing up, and if they are a certain type of personality, if they're kind, if they are not aggressive, if they are I don't know how to say this, but just a very good person, then this is how they will be during their illness. If someone has been a very aggressive, a very demanding, a very forceful person during their younger years, this is how they react in the disease, more so. So the personality, what I'm saying is, what I've read, the personality continues. Sometimes the personality stays the same. Sometimes it becomes more so. But I'm curious to know if this is a fact, if anybody knows it is a fact, if it has been studied. It's something that I've always thought about.
Mm-hmm. Lucy, do you want to start, or do you want?
I'll start, and then please. Thank you for that question. It's an excellent question. As far as my understanding and what I've read and what research that I've dealt in this, there's a lot of research on this for sure. I can tell you that because someone has dementia, their personality can change. That means that if they were aggressive in the past, they can become very passive when they have dementia, and vice versa. People who were, very passive and calm can become very aggressive. So I think that it's not just the way they were. They could continue being the way they were and become more aggressive if that's the way. But in general, I think that there are changes. So I'm wondering, Joanne, are you on the same page as this, or can you add a few more thoughts?
Well, I'll add first of all, I really appreciate the sharing and the fact that you're reading a lot and going through the research. So in order to answer that question from a research point of view, I'm not able, but I think it would be interesting to look at the studies. So two things I want to say. First, generally, the patterns that we've had in life, and we heard somebody who had patterns in marriages. Generally, those patterns definitely, do continue on, but it depends so much on the type of dementia and where in the brain your dementia is. Someone mentioned the frontal lobe, temporal lobe. There are incredible changes in personality with certain types of dementias, again, as part of the brain. For instance, we've seen situations where somebody in their lifetime would never utter a swear word. And all of a sudden, with these types of dementias, their language is profanity, and it's startling and frightening to family members. So I too, from our participant who shared that, I would love to know what the research says, but we've also seen both. And I just want to give you a good example. I've had an experience personally in my life with someone that I was close to who we didn't get along during our lifetime. There was a lot of tension. And when their dementia progressed, they actually became softer and kinder, and our relationship improved, and they were able to show appreciation to me that they never did earlier in my life. So, the thing with dementia, it's a pocket full of surprises. We often don't know what we're going to get, but education is a key. So I think that's a way we continue to find out more. I just wanted to make one more link to one of the questions in the chat about the family member where the mom is not open to getting help. And the sisters, I think it was mentioned, the sisters are getting all the help they can. I know, Lucy, and I really want to reinforce that, because we can't always lead people to get the help they need or make the changes. So often the only control we have about coping is getting our own help, reading ourselves, and furthering our knowledge. The only thing, though, that you can control, maybe that can affect someone else again, is your energy and the way you react. So I'm going to leave my comment there.
May I add something, please? I just recently read an article about something in the U.S., which I would say is probably very typical of Canada as well. There's so little help for this type of disease, for this type of issue, help for people, and it's become a huge population of people with this illness. With the money, I don't know if there are lots of examples of money being put into research and so on. But this article absolutely said that there is very poor help for people dealing with this particular issue. And Lucy, and when you say that you have to go for help, well, sometimes finding help is very difficult, very difficult. Especially coming from COVID, and I'm sure analysts and therapists are exhausted, are probably up to their eyeballs. But when you say go for help or get help, I mean, I am sure, like myself, I would do anything to find somebody who would sit down with me. I would pay anything to sit down with me and tell me what I'm dealing with, how should I deal with it, how to proceed. It's almost impossible to find. Almost impossible to find.
Are you calling from the United States? Are you?
No.
You're here.
No, I'm right here in Montreal.
You're right here in Montreal.
But I'm just saying that I get the New York Times every Sunday, and it's an excellent newspaper, and I read many articles, and one of them happened to be about people needing help in this particular area and how hard it is for them to find help. Organizations I don't know whether they're flooded with this, but help is not there the way it should be, because it's becoming a very universal problem.
Yeah, you're not wrong there. It is challenging to find, but there is help out there, because there's a difference between help and specialized help. This is a really specialized area.
Yes.
And it's a newer area, and there's a lot of work being done in it to educate people to become specialists in this area. But it's growing, and I'm sorry about the frustration about getting help. We do hear that it's been harder since the pandemic. There's for sure resources are tight, but there is help out there. And what I can say at the end of this, if you put something in the chat, maybe we can send you a little email about some places to seek help. Not to say there are not wait lists, not to say that if you call your CLSC, you're going to wait, but just I say don't give up. And kudos to you for joining these kind of groups where we can honestly share, hey, the help isn't there that we need. This is a huge problem and the government's way behind. But we have to be hopeful. We have to help each other. And what you've done through education is really empowering for yourself. And the Alzheimer associations, there are organizations like APUI. May I continue, though, your comments just with the next slide? Would that be okay with you?
Absolutely.
We do, Joanne, we do have a few comments. So I just wanted to mention there were a few people who mentioned, going back to what you said earlier, that sometimes, a person's behavior prior to the diagnosis is inconsistent with how they act after. So there were a few people who just made comments on their own personal relationships.
Okay.
So thank you for
So
sharing
please do share them with us. We'd love to hear them.
Perfect. So this comment, it has not been my family's experience that a calm, kind person will be a calm, kind dementia patient. My father was a lovely, kind teddy bear of a person and is extremely aggressive. Maybe he's an anomaly.
No. We've seen a lot of that.
That's right.
Thank you for sharing that. It's important.
We have another comment. Yes, my partner started swearing and calling me names, and it was so bewildering. I had never heard him swear in my life.
Yeah.
So you're not alone.
Thank you.
And then we have sorry, I think there was a few.
There was a few hands going up, I saw.
There's also a question about any idea, and maybe you're going there with this, I'm not sure, but any ideas on how to convince the person who has the condition to bathe? We're having difficulty convincing our mother that she needs to bathe. Her response is she already took a bath earlier in the day and gets upset if we stay on topic. Any ideas would be appreciated.
Yeah.
Well, yes, hygiene is very difficult many times with people with dementia. Bathing is an issue. There's no doubt about it. But before I even start giving a few tips on that, I do want to say that if they used to take a shower, let's say every day, it doesn't necessarily mean that you have to keep that routine. You know, there is sponge bathing. So if it's a huge, big problem, don't push it to that limit. But there is ways to, first of all, you really have to take the time, as Joanne was talking about, scheduling. Having a shower, it's going to take at least a good hour if you have if the person doesn't want to have. Now, some caregivers have told me they have the same issues and they would tell their mother, we're going to have a spa day today, you and I, you know, by preparing the bathroom in a certain way, by making sure it's warm, but just being part of that, that there's nice towels. Some caregivers even mentioned that they put scented candles. They put on music. And so trying to redirect the person to come and to join in that. It doesn't always work, that's for sure. So bathing is an issue. One caregiver was saying that when her mother would go in to take a shower, but all of a sudden she would become very agitated. So she always had a bowl full of strawberries in the bathroom because her mother loves strawberries and she would offer it to her. So again, it's that, you know, that redirection, that, you know, pointing them to a new, it's not easy. It really, really isn't. But there is ways to do it, and you do need the time to do that. And thank you so much for that question. It's important.
Thank you.
I hope a few tips have been helpful. Try them.
Yeah. Okay. So, and also just maybe we can add about the bathing. I love what you started to say, Lucy, about setting up the bathroom to be calm. Music, again, is bringing them into the music and inviting them to be ready. And then, minimizing the frequency of bathing. I did want to mention that Claire Webster did, there is another webinar in the, what's the section, Diane? The section of the Dementia Education Program.
The archives. Yeah. I'll put the link in the chat.
Yeah. Okay, put it in the chat. There's one that you might want to check out by Dr. Doyle. It'll be in there, and he does talk a little bit more about the bathing and some of those issues as well. So this can complement what we're saying. So I think what we're hearing from the chat and what Lucy and I've been saying, it's so hard to predict behaviors by the past. It's such a mixed bag, and everybody has their own unique experience. So I think that's the point to impress, and why you really are left to figure out your loved one by really just tuning into what are they doing now? What are their behaviors? if you're doing all of this and you're reading and you're following all these different options that we've suggested, but you're just at the point where you feel like you need to just reach for that life preserver, there are pharmacological options as well. We want to start with some of them, the less invasive ones, but sometimes you'll do a combination. There are antipsychotic drugs, there are antidepressants that can help calm some of these behaviors, and that's where you'll want to consult your physician or your gerontologist as well. It takes a little bit of time. There can be some side effects with other medications, and I find physicians are also hesitant sometimes because they can cause falls, which we are always fearful of. So we have to work with them. And then that being said, and we're seeing how difficult it is, this is sometimes the tipping point, these behaviors, to make us think about, wow, okay, am I able to manage this? Am I able to deal with these behaviors? And if you're at that tipping point, it may be time to think about or consider other places to live, like seniors' residences and nursing homes that are specialized in these areas. There are nursing homes that have special wards where they have behavior techniques where they're more educated and can help bring about some positive changes. So it's not always a last resort. Sometimes it's the best resort. So something to really bring up with your care team, your physician. But this often we see that these behaviors, when they become more frequent and more intense, this is the tipping point where it's really hard to stay at home. So at this point, I'm going to stop the slides and we can just continue our conversation. We just have about another 5-6 minutes. So really, can we just invite anybody who has last comments, or if there's anything in the chat that we haven't seen, perhaps Diane, you could read it to us.
Sure. So we just got a question now. What about if a parent is in denial and does not want to get help?
That is such a common one. I'll start, Lucy, maybe you'll want to add, but back when I was working at the CLSC, we often got requests for that, exactly as this one. We need help, but my parent or my partner doesn't recognize, they don't see it. Remember, they're not remembering, they're not seeing things as we do. Then it's there's two things. One, we have to look at the risks. If they're doing things that are risky and that could put you or them or others in danger, then we find our ways to help. Sometimes we have to bring somebody in to hospital for examination. But if the behaviors aren't dangerous yet and they're just difficult and difficult to cope with, this is probably the hardest time for caregivers who either live with them or don't, because it's scary. They don't see, they won't get help. So this is where you start to seek help. If you live with them, you can invite somebody into the home for you. Tell them it's for you. You want to meet with someone. And then maybe as they become more familiar with the person in a very gentle way, they start to develop a relationship with them, but very, very challenging. And Lucy, maybe you want to add something to this?
Oh, it is extremely challenging when they refuse because they don't have the insight to realize that they're not who they were before. It's interesting what you said, because I had to face that myself in my caregiving journey. And I just told my mother, like, I'm sending someone in because do it for me, because I still have my kids at home and my family, and I'm working full time. And for whatever reason, she accepted it, because it's not for you, but it will make me feel better that somebody is here or just to help you. It's not always going to work. It's hit or miss. I mean, it's a difficult journey. There's no buts or ifs about it. And each person is so individual. And as we said, their personality can change with dementia.
I have a question, if maybe one of you can speak to, that I see often families maybe a son is visiting his mom and he'll say, "Hey, mom, you remember what your grandson's name? My son, you remember what his name is, eh?" And they have trouble and they'll start saying, "Oh, such a nice grandson he is," or whatever. And they'll say, "No, but do you remember his name, mom?" And they're not in denial, but or do you remember what we used to do on Monday night, every Monday night, mom? They're just trying to grasp and bring their mom back to how they were before dementia. And it's a natural thing. But can you speak to that and maybe just sort of, what you would do in that situation and maybe, about that a little bit?
Well, I think if I may, Joanne, I'll just start. Denial is a big word. Many times caregivers have a really hard time facing the fact that the person that they're caring for is no longer the person that they are. And what makes it difficult is that, as we touched on it, that there's some good days and there's some bad days. So like, what's going on here? It's just, so I mean, the denial part is when you keep asking the person who you see is not able to really answer. It's not about them, it's about you. You have to be able to recognize if they're giving you signs. Remember, communications go with their words, what Joanne was saying. That's what this is about. If they're not remembering and they're trying to, then you have to stop it and sort of just say, your grandson John is going to be coming over, wants to visit you, misses you, sends regards. Do not antagonize in a sense. You're not doing it on purpose. Accept it. For me, my caregiver journey really became possible was when I accepted. I accepted who she was now and didn't have too many expectations apart from what she was able to give, to do at that time.
I love that answer, Lucy, because a lot of the answers are really within ourselves and accepting and moving. And the only thing I would add to that is if you feel a need as a caregiver to go back and have those conversations, that's a good time to pull out an album, a photo album, and go back. And because that may reach your loved one in a different way, and you can have conversation around the pictures. And that's something that, as I'm telling you, I remember doing with my grandmother at the end of her life when she just couldn't communicate with me in any way. And I just brought the albums and we would go through them, and it would somehow bring back a little bit of comfort to me and some reminiscing for her. I think it's 11:57. Oof, the time flew.
I just want to add one thing before we go to all the caregivers out there. In order for you to continue this journey that you're going through, you have to take care of yourself. I know it's been told to you over and over and over again, but it's so, so important that you have the respite, that you take a little vacation. It doesn't have to be for long, a couple of days. You need to rejuvenate yourself. You really do.
That's a great message to end with. And I hope this will be part of taking care of yourself, of joining Lucy and I in our caring conversations. So because there's 2 minutes left, I do have to conclude with these words. And first, thank you so much for sharing and joining us and listen. Look for the registration link on our website at www.mcgill.ca /dementia. I'm sure it's going to be put in the chat next week and in your inbox the week of November 7th. And just a reminder, this is a pilot project. So it's really important for us to know how Caring Conversations is working for you. We're going to send you a very short evaluation form by email, please. And the link is in the chat box if you want to fill it out right now. We really appreciate your feedback because we want to make this good for you. Caring Conversations, supported by Petro-Canada Caremakers Foundation. It's a project of the McGill Dementia Education Program, which is funded entirely by private donations. So we're grateful. We hope you found today's conversation useful. Be sure to join us next month for Caring Conversations. And this time we're going to talk about how dementia affects our relationships with the person we're caring for. This time it's going to be at 2 p.m. on Thursday, November 24th. So we hope to see you there. Be well and take care, everybody.